Welcome to today's deep dive. We are setting out on a very specific mission today.
We really are.
Yeah, one that tackles well, a pretty intense medical mystery affecting countless women who are basically suffering in silence.
Right. It's incredibly common, but so rarely talked about.
Exactly. So we are looking at a highly targeted, yet incredibly impactful question today.
Which is, can cytolytic vaginosis, commonly referred to as CV, cause a cyclical acidic burning sensation during intercourse that perfectly mimics recurrent thrush?
Right. And to get to the bottom of this, we are pulling from a really diverse stack of sources.
Yeah, we've got primary care portals and clinical medical guidelines to ground us in standard protocols.
Plus a really comprehensive scoping review published in the journal PLOS One.
Which maps out everything the scientific community currently knows and, doesn't know about the condition.
Right. And to anchor all this clinical data in reality, we're incorporating some truly harrowing firsthand patient accounts from Women's Health magazine.
The blend of those sources is just critical for a topic like this. I mean, the PLOS One review gives us the aerial view of the systemic gaps in medical knowledge.
Yeah, while the patient narratives force us to confront the actual devastating human cost of clinical misdiagnosis.
Absolutely.
So to really understand those stakes, I want you to imagine for a moment that you are suffering from severe debilitating pain.
Like a relentless acidic burning sensation?
Right. The kind that makes even just sitting in a chair agonizing. So, naturally, you go to the doctor.
Of course.
And you take every prescribed treatment they hand you round after round of antifungals and antibiotics.
Which is standard procedure.
Right. But when those completely fail, you take matters into your own hands. You buy massive amounts of over-the-counter probiotics.
You start eating specialized fermented foods, live yogurt.
Yeah, operating on the standard assumption that you just need to restore your body's natural balance.
If that's what we're always told to do, right?
Exactly. But instead of getting better, the pain intensely spikes. You eventually discover that the very cure you've been diligently taking is actually throwing gasoline on an already raging fire.
It's a complete nightmare scenario.
It really is. So, okay, let's unpack this. We are talking about a scenario where the microscopic good guys go completely rogue.
Yeah, the clinical literature often refers to this state as lactobacillus overgrowth syndrome or Doederlein's cytolysis.
Okay.
And to grasp how devastating this can be, we really have to look at the baseline mechanics of a healthy vaginal ecosystem.
Right. What's it supposed to look like?
Well, in an optimal state, bacteria called lactobacilli are the absolute dominant species. Their primary role is essentially environmental defense.
So they're the protectors.
Exactly. Under the influence of estrogen, the vaginal epithelial cells produce a type of sugar called glycogen.
Okay, so the cells are making food.
Yes, and the lactobacilli consume this glycogen and metabolize it into lactic acid and hydrogen peroxide.
Which is the mechanism that keeps the vaginal pH acidic, right?
Yeah.
Usually somewhere between 3.8 and 4.5.
You got it. And that acidity is the ultimate defense system.
Because it creates this highly inhospitable environment that stops outside pathogens, like the candida yeast responsible for thrush or other bad bacteria from taking hold.
Right. But what's fascinating here is how quickly a biological strength becomes a profound liability.
Right, because too much of a good thing.
Exactly. The damage in cytolytic vaginosis isn't caused by a foreign invader or an infection in the traditional sense.
It's an inside job.
It is an extreme runaway exaggeration of that exact normal function. The lactobacilli population just explodes.
So there's simply too many of them occupying the space.
Right, and because of their sheer numbers, they're metabolizing glycogen at an astronomical rate.
Which means they're producing a massive, continuous deluge of lactic acid.
Exactly. The pH level plummets, often dropping below 4.0, down into the highly acidic 3.5 range.
Wow. So the environment becomes so acidic that it actually turns on the body itself.
It really does.
I was thinking about this, and it's kind of like having too many overzealous bouncers at a nightclub.
That is a perfect analogy.
Right. You hire them to keep the bad guys out, but suddenly there's this massive army of them, and they're so aggressive and hyped up that they start throwing out the actual paying guests.
Tearing up the furniture.
Yeah, tearing up the furniture and setting the bar on fire.
That aggressive dismantling of the environment is literally happening at a cellular level.
Man.
This hyperacidity chemically denatures the proteins in the vaginal lining.
Meaning it destroys them.
Yes. The acid degrades the walls of the vaginal epithelial cells until they physically rupture and dissolve.
That sounds horrific.
It is. This biological destruction is a process known clinically as cytolysis or epitheliolysis.
So you are essentially experiencing a sustained acidic chemical burn
Mm.
caused entirely by your own hyperprotective flora.
Exactly. And because the tissue is actively being burned and destroyed, the patient is feeling a fiery itch and agonizing pain.
A pain that feels identical to a much more famous condition. So the doctor takes one look, assumes the most obvious culprit, and the patient falls straight into the misdiagnosis trap.
Which happens so often.
Yeah, the Women's Health source highlights how CV is just the ultimate imposter for recurrent thrush.
It really is. The clinical presentation is almost indistinguishable to the naked eye.
Really, just identical.
Pretty much. If a patient is experiencing the cell rupture we just described, the nerve endings are going to fire in a way that mimics severe vulvovaginal candidiasis.
Or thrush.
Right. The patient reports intense burning, severe itching, and agonizing pain during urination.
I mean, because the acidic urine is hitting raw, microabraded tissue, right?
Exactly. It's like pouring vinegar on an open wound. They will also present with a white or yellowish discharge.
Which often takes on that thick, curdy appearance characteristic of a yeast infection.
Yes. And, critically, the inflammation makes penetrative intercourse severely painful or entirely impossible.
I was reading the patient narrative from the Women's Health article,
Mm.
and the psychological toll of this mimicking effect is just devastating.
It's completely life-altering.
Yeah, there's an account of a woman who lost an entire year of her life to this misdiagnosis.
A whole year.
The pain was so searing and so constant that she couldn't even sit at her desk to do her job.
Wow.
And the sheer terror of her body failing, combined with doctors repeatedly telling her it was just a stubborn case of thrush, it drove her to the brink.
I can't even imagine.
She was in so much unyielding agony that she ended up developing an addiction to prescription codeine just to physically get through the day.
That is just, it's tragic. And the psychological trauma is totally compounded by the medical response.
How so?
Well, when a doctor sees a clinical picture that perfectly mirrors thrush, the immediate reflexive action is to prescribe antifungal medications.
Which makes sense on paper.
Right. The patient goes home, uses the creams, or takes the oral medication, and naturally nothing improves.
Because there is no fungus to kill.
Exactly. So the typical next step for a proactive patient is to assume their vaginal flora has been wiped out by the medications.
Oh, right. So they go to the pharmacy and start a heavy regimen of targeted probiotics,
Specifically trying to repopulate their lactobacilli.
which is the gasoline on the fire effect.
Precisely.
It really is like trying to put out a grease fire with a giant bucket of water.
Yes. You think you're using the standard logical tool to extinguish a fire.
But the specific chemical nature of this particular fire means you are just instantly exploding the flames across the entire room.
You are dumping millions of new lactobacilli into a microscopic ecosystem that is already choking and dying from an overabundance of them.
You're actively feeding the very mechanism causing the chemical burn.
You are, but the persistence of this misdiagnosis highlights a massive blind spot in standard diagnostic practices.
Yeah.
Because thrush is incredibly common and CV is considered relatively rare, many clinicians rely heavily on empiric treatment.
Meaning they just guess based on symptoms.
Basically, yeah. They treat based entirely on the visual symptoms and the patient's verbal history without ever taking a swab to look at the fluid under a microscope.
And even if they do take a standard swab and send it to a lab for a culture, the results can be really misleading, right?
Oh, completely.
The sources point out that standard fungal cultures might pick up a tiny, harmless amount of background yeast that naturally lives in the body anyway.
Right, just normal flora.
But the doctor sees the word candida on the lab report, their inherent bias is confirmed, and they just prescribe stronger antifungals.
It's a vicious cycle. CV is fundamentally a diagnosis of exclusion in the modern clinical setting.
Meaning they have to rule everything else out first.
Right. A practitioner has to actively and meticulously rule out candida, bacterial vaginosis, and sexually transmitted infections before the concept of an acid-induced burn is even entertained.
Man. So if the visual symptoms are identical to thrush, and standard lab cultures can be misleading, how can you, the listener, or your doctor tell them apart without immediately resorting to a microscope?
That is the million-dollar question.
Right. Well, the PLOS One Scoping Review points to something incredibly specific and actionable here. The golden clue lies in the calendar.
The timing of the pain provides the most critical diagnostic data available outside of a laboratory.
Okay, tell me more about that.
Well, in the medical literature, cytolytic vaginosis is frequently referred to as cyclic vulvovaginitis.
Cyclic, meaning it follows a cycle.
Yes. The burning and the tissue breakdown do not happen randomly. They follow the precise hormonal rhythm of the menstrual cycle,
Right. The sources outline that the symptoms violently peak during the luteal phase.
which is that specific week right before menstruation begins.
And it all ties directly back to that cellular sugar production we talked about earlier.
Exactly. So during the luteal phase, a woman's levels of estrogen and progesterone hit their peak.
Okay.
This hormonal surge acts as a direct signal to the vaginal epithelial cells, instructing them to maximize their storage of glycogen.
And glycogen is the food for the bacteria.
Right. So for a lactobacilli population that is already dangerously overgrown, this sudden dump of sugar is an absolute feast. They gorge on the extra glycogen, multiply even faster, and produce a massive concentrated spike in lactic acid in the days immediately preceding the period.
But then comes the biological plot twist, right? The patient will often notice that the very second menstrual bleeding begins, the agonizing symptoms abruptly vanish.
It's incredible.
The burning stops, the itching subsides, and the relief is almost instantaneous.
And the reason for this is purely chemical. Menstrual blood is highly alkaline.
Right. Blood has a natural pH of around 7.35 to 7.45.
Making it a strong base relative to the vaginal environment.
So when that alkaline menstrual fluid flows through the vaginal canal, it acts as an immediate, powerful chemical buffer.
It temporarily neutralizes the hyperacidic environment, drastically raising the pH,
Which instantly stops the chemical burn.
giving the damaged raw tissue a brief window to rest and begin repairing itself.
It's like dropping a massive antacid tablet into a bubbling vat of vinegar.
Ah, yes.
Or throwing a thick biological fire blanket over the flames. The acid is just instantly suffocated.
That's exactly what's happening mechanically.
So what does this all mean for someone listening? It means if you are stuck in a seemingly endless cycle of recurrent yeast infections and standard treatments are failing, you need to become the data scientist of your own body.
Yes. Track your symptoms.
Track your symptoms against your cycle. If the intense, fiery itching consistently peaks the week before your period and magically vanishes the day you start bleeding, that is a massive glowing neon sign.
Pointing away from a fungal infection and directly towards CV.
Yes.
And, if we connect this to the bigger picture, it highlights how profoundly hormonal shifts dictate the behavior of our microbiome.
It's not just about the menstrual cycle, is it?
Not at all. We are not just talking about the luteal phase here. The clinical sources note that cytolytic vaginosis can also flare up during other major periods of hormonal fluctuation,
Like pregnancy.
pregnancy, or the onset of perimenopause. Those physiological states also drastically alter estrogen levels, which in turn alters the glycogen supply.
So the environment always dictates the behavior of the bacteria.
Exactly.
Okay, let's say you've tracked your cycle, you see this undeniable pattern, and you suspect CV. You finally advocate for yourself and get to a specialist.
Which is a huge victory in itself.
Totally. I was looking closely at how they officially diagnose this, and the standard relies on Sibley's 1991 diagnostic criteria.
Yes, the gold standard.
What completely blew my mind about these criteria is that they're looking for a total absence of white blood cells.
Right.
I mean, if you have an infection, your body sends white blood cells to fight it. The fact that the microscope shows 0 white blood cells proves the immune system doesn't even realize the body is under attack.
Because the damage is coming from the good guys.
That is wild.
It is a crucial diagnostic differentiator. The specialist must perform wet mount microscopy, taking a fresh sample of the discharge and examining it under a microscope right there in the clinic.
And Sibley's criteria demand 4 specific findings, right?
Yes. First, a pH level strictly between 3.5 and 4.5.
Super acidic.
Second, an overwhelming abundant presence of long, coarse lactobacilli. Third, as you noted, the complete lack of white blood cells indicating no inflammatory immune response.
And the 4th criterion is the presence of bare nuclei, which is just a fascinating, slightly morbid visual.
It really is.
Because the excessive lactic acid is literally dissolving the outer walls of the epithelial cells, the microscope will show these naked, exploded inner cores of the cells just floating there in the cellular debris.
It is literal visual confirmation of the chemical burn.
Plus, obviously, they need to see absolutely 0 presence of yeast, trichomonas, or harmful bacteria.
Exactly. And once the clinician sees that cytolysis under the microscope and confirms the diagnosis, the treatment protocol requires a complete 180-degree pivot.
From how modern medicine normally treats vaginal discomfort.
Yes. Because the root of the problem is extreme hyperacidity, the only logical solution is targeted alkalinization.
Okay, so you have to intentionally make the environment inhospitable for the lactobacilli.
To force their inflated numbers back down to a normal, manageable baseline.
And the treatment for this devastating, year-stealing pain is shockingly mundane.
It really is.
It's baking soda. Standard over-the-counter sodium bicarbonate.
Yeah.
I read that and had to laugh. The stuff sitting in the back of my fridge absorbing the smell of last week's leftovers is the clinical cure for this condition.
It sounds crazy, but it is environmental chemistry in its purest form.
Right.
When you introduce a strong base like sodium bicarbonate to the environment, it doesn't just soothe the burn, it fundamentally alters the local pH.
So by aggressively raising the pH, you alter the enzymatic conditions.
Exactly. The specific enzymes that lactobacilli use to metabolize glycogen physically cannot function in an alkaline environment.
Wow. So you are effectively starving them out and interrupting their life cycle.
Precisely.
The sources outline a few ways this is administered. Patients might be directed to create a specific dilution of baking soda and warm water to use as a douche.
And it's worth noting that while douching is heavily discouraged across the board in gynecology, this is one of the rare, highly specific exceptions done under strict medical supervision.
Right. Do not try that without a doctor. Alternatively, patients take baking soda sitz baths a few times a week.
Or they carefully fill empty gelatin capsules with baking soda to use as a targeted time-release suppository.
The lifestyle modifications are equally focused on meticulously managing that environmental pH too.
Yes, the protocols require patients to avoid all soaps or body washes in that area.
Completely halt any and all probiotic supplements.
Throw out the remaining antifungal creams, and this is a critical mechanical detail switch entirely from tampons to pads during menstruation.
Right, because a tampon acts as a sponge. It absorbs that highly alkaline menstrual blood and physically pulls it away from the vaginal walls.
Exactly.
So by switching to a pad, you allow that alkaline blood to naturally coat the vaginal canal for a much longer period.
Maximizing its natural ability to neutralize the acid and suppress the lactobacilli.
It's brilliant in its simplicity. But looking at the PLOS 1 review, we have to address the elephant in the room.
Yes, the controversy.
Right. We are impartially reporting the data provided in these sources, and the data explicitly states there is a significant medical controversy here. Not all gynecologists actually believe cytolytic vaginosis is a real standalone disease.
That's right.
I have to push back on this, though. If we have highly specific criteria from 1991, and we literally have microscopes showing exploded cells and bare nuclei floating in acid, how can the medical community still be debating its existence?
This raises an important question about how the medical establishment defines a true disease pathology versus a physiological extreme.
Okay, what do you mean?
Well, some specialists argue that what we are calling CV is actually just a normal physiological shift in the flora that is being misinterpreted.
Misinterpreted how?
Because lactobacilli are supposed to be the dominant species and their numbers naturally heavily fluctuate with estrogen levels, some researchers believe diagnosing an overgrowth is entirely too subjective.
Like, what is the line between enough and too much?
Exactly. The threshold for what constitutes too much good bacteria isn't universally agreed upon.
And the literature mentions that skeptics argue the symptoms might actually be masking an underlying condition, like provoked vulvodynia.
Right, which is a complex chronic nerve pain issue in the vulva.
So they argue the high lactobacilli count is just a coincidental bystander, not the actual cause of the nerve pain.
Furthermore, because CV is historically poorly funded, poorly researched, and completely lacks large-scale, randomized, double-blind clinical trials, it hasn't achieved universal acceptance in medical textbooks.
That is so frustrating.
It is. And this debate highlights a massive systemic issue. There is very little training on clinical microscopy for modern general practitioners.
Which means if your primary care doctor doesn't have a microscope in their office,
or isn't specifically trained to identify bare nuclei and cytolysis on a wet mount, they literally do not have the tools to diagnose CV.
wow. This is why all the sources emphasize the absolute necessity of seeking out a dedicated vaginitis specialist.
Someone who analyzes fresh cellular samples in real time rather than just writing a prescription based on a verbal checklist of symptoms.
That context is incredibly validating for anyone who has been sitting in a doctor's office being told their agonizing pain is all in their head simply because a standard lab culture came back negative for a yeast infection.
So validating.
So let's distill all this down to the core takeaways from the research.
Okay.
Yes, for a specific subset of patients, cytolytic vaginosis causes intense, cyclical, acidic burning and immensely painful intercourse.
It is a master mimic of recurrent thrush.
But it actively thrives on and is worsened by the very probiotic and antifungal treatments meant to cure thrush.
Right. And to resolve it, the body requires a targeted alkaline counterattack, utilizing something as wonderfully simple as baking soda to aggressively restore the environmental balance.
It fundamentally requires both the patient and the practitioner to change their paradigm.
You have to stop reflexively treating the visual symptoms and start identifying the underlying environmental mechanism driving the ecosystem.
And this connects right back to your own empowerment as a patient. Whether you are dealing with CV or any other persistent unresolved health issue, if a treatment is actively making you worse, you must question the diagnosis.
Absolutely.
Your body's patterns are vital empirical data points. The exact timing of your symptoms, how they violently react to your menstrual cycle, how they worsen with certain over-the-counter medications, that is the hard evidence you need to aggressively advocate for yourself.
Don't let anyone tell you to just take another round of antifungals if the house is still burning down.
Exactly. It is about trusting the timeline of your own biology over a generic symptom checklist.
Which brings us to a final, slightly mind-bending thought to leave you with, pulled straight from the evolutionary context in the research.
Oh, this part is fascinating.
The sources point out that human vaginas are entirely uniquely dominated by lactobacilli compared to other mammals.
And there's a prevailing theory that this wasn't always the case, right?
Right. It was likely a massive evolutionary shift intrinsically linked to the agricultural revolution.
Wow. So when early humans transitioned from hunter-gatherer diets to cultivating and eating high amounts of agricultural starch and carbohydrates, it fundamentally altered the baseline glycogen levels produced in our bodies.
Yes. That dietary shift paved the way for lactobacilli to evolve into the dominant protective force we see today.
It was a brilliant, necessary evolutionary adaptation to a changing environment.
But it makes you think.
Right, because if our internal microscopic ecosystems shifted that dramatically based simply on the historical introduction of farmed agriculture, what are we doing to ourselves right now?
Right.
We live in a modern culture absolutely obsessed with gut health. We are bombarded with marketing messaging telling us to consume daily kombucha, kefir, and highly concentrated probiotic supplements packed with tens of billions of active cultures.
We are continually, intentionally pushing ourselves to ingest more and more bacteria.
Exactly. If an overgrowth of our own good bacteria can literally dissolve our cellular walls and cause debilitating chemical burns, are we inadvertently creating entirely new classes of modern dysbiosis?
Like new synthetic imbalances.
Yeah, that our current medical system simply isn't equipped to recognize yet.
It forces us to seriously reconsider our modern definition of what healthy means. A deeply evolved protective mechanism, when pushed too far by aggressive modern supplementation or sweeping hormonal changes, can easily become the very thing causing the harm.
There's a very fine line between a thriving ecosystem and an overgrown jungle.
Very well said.
So the next time you reach for that highly marketed cure-all probiotic supplement, just remember, sometimes you might just be throwing gasoline on the fire.